Thank you. And Paul stumbled over the acronym there. As you know, in the NHS, we have lots of acronyms. And I'm Chief Exec of the HSN network nationally, and my own HSN is called the Innovation Agency. So we changed our name, actually, because people did stumble over the name. It didn't talk about what we did, so we're called the Innovation Agency. And the purpose of Academic Health Science Networks is to bring together health services, care services, industry and our academic partners to bring innovation into health pathways so that ultimately we support residents in managing their own health. If they have to go into a healthcare institution, that quality of care is brilliant because we're using the most up-to-date technology and innovation. So there are 15 of us across the country. I chair the network of 15. And why we have a network of the 15 working together is that if we have an innovation that works in one region, we should be able to adopt it and spread it right across England. So that's the theory behind it. It works well. If you want to look at some of the work we've been doing, we have the HSN Atlas, which outlines some of the programmes that have been worked on in individual HSNs and then adopted and spread across the country. So we're funded mainly by NHS England and NHS Improvement and other funding sources such as Europe to develop with some other technology partners. And some of the things that Beverly's talked about, we put into practice on the ground. So we can be that local link from NHS England into partners who are working in regions. So the financial context of the NHS, and this sort of is going to put some of the presentation into context. It's the world's largest public integrated health service. It actually gets good results when we look at satisfaction from users, even though we read in the press some worrying stories. Actually, normally service users are satisfied. We spend a lot of money, £120 billion per annum. And as you'll know, if you read any of the papers, listen to the radio, there is a financial gap in all our public services. So what we need to do when we're developing technologies and service improvements is to make sure that we always consider how much they're going to cost, will they save money or give better quality for the same amount of money. So Academic Health Science Networks are partnership organisations, and within that we cover all the providers of NHS services, we cover many local authorities, we cover the buyers, the clinical commissioning groups. So if you're somebody who's got a great innovation, a great technical product, we can introduce you to some of those people who can either give you feedback or can help you to get those products into pathways that support service users. And that's one of the unique features of Academic Health Science Networks. We're the only body that's funded centrally from NHS England to look at innovation, look at how that impacts on health and support innovation into a service that sometimes doesn't really like to adopt innovation or doesn't have the time or feels it doesn't have the time, and also to improve economic growth. So in our performance metrics, we're measured on how many businesses we support, how many jobs they increase by, how many products we get into the market. And ultimately, economic growth is also about people staying in work. So if people are healthy, because we can support them to manage long-term conditions or not become ill, that also has an economic impact right across England. So that's the theory behind what we do. So what have we actually been doing in practice? So this slide is taken from our impact report for last year. So we work on the Small Business Research Initiative programme, and last year £20 million support was invested through that programme. And we're going to talk a little bit about that later on and how you might access that if you've got a product at an early stage. We use some really, really simple technologies. People may know about Flow, which is a text messaging service for people with long-term conditions. Last year, there were 33,000 patients that we supported to self-manage conditions using Flow. That's up to 40,000 patients now. It's really simple. It uses technology that everybody has. We run the NHS Innovation Accelerator programme, which is also sponsored by us and NHS England, and I'm going to talk a little bit about that and how that's benefiting residents across the country. Within our jobs function, we either created or safeguarded 800 jobs. We run the Patient Safety Collaboratives for NHS England, for NHS Improvement, and the reason that they sit with HSNs is that we can actually bring technology into some of the safety pathways that we have across our provider organisations. So there's a real good synergy there with innovation, new products and techniques that we can support our organisations in patch with. Beverly's talked a bit about the testbed sites. We support the testbed sites. And I'm going to talk about a really practical example of how we've been preventing strokes. So great from a PR perspective. Last year, we added up all the strokes we think we've prevented, and it was 365. So by using technologies and associated pathway changes, we prevented a stroke a day across England. So we all know that you might have a great innovation, you might have a great tech product, but actually if we haven't got the right people there who are willing to adopt that, willing to look at it, willing to think about how that would fit within the current work, we're not going to get anywhere. So one of the things that we do across Academic Health Science Networks is to bring people together and to actually open their minds to the possibility of innovation. And we have a saying in the HM that I'm in, which is about show me the thing. And we carry around our eye bags, and they're our innovation bags. And if somebody says to us, what's innovation? We can actually take products out of the bag and say, this is an example of something that's a bit different. It's an innovative product. So they start to think about innovation in a real way. So these are, from the Innovation Agency, these are some of our innovation scouts. And they're champions of change for innovation. So we've got innovation scouts who sit in provider organisations such as hospitals, commissioning organisations, universities, and they actually are people that we network together. We take them out of health and care services to look at what's going on in other areas so that they can start to think about how they might use those techniques in their own organisations. So we start to create this network and culture of innovators. Sorry, I'm just going to take a drink. And one of the things they've been working on and that they really sort of sparked their imagination was 3D printing. So the photograph you can see with the doctor, that's a 3D printed heart. And this heart's been printed, it's somebody's actual heart, it's a replica of somebody's heart, so that a surgeon can look at that and think about, now I'm going to do this operation on this person. How do I actually go about that operation? Which bits do we need to target? And work with the team so that when they get into the operation goes smoothly. So that's one of the things we carry in the bag, and that's innovation in action. And we have a big children's hospital in our region, Alder Hay, and we actually have a tiny 3D printed children's heart that's a print of a child's actual heart, so the surgeon can use that innovative technique to think about how he carries out an operation and saves a life. So as well as supporting individual scouts, we also, across HSN's networks together. And we think this is really important because this helps to break down barriers. So if you're somebody that's in a health service, you don't really understand what tech's out there, you don't understand maybe what innovation, what potential some of the tech has got for innovation, we can network you with somebody who can tell you about that, who can point you to their own example of tech, and you start to talk the same language. So we get a culture of innovation and being open to new things across the system. So this is our Ignite network, and this is a network of 140 doctors who come together to think about innovation, doing things differently, and designing harm out of NHS pathways. So what innovations can they bring in to make sure that we design defects out of NHS pathways? We run ecosystems, we run a European Connected Healthcare Alliance ecosystem that many of you will be involved in, where we bring together innovators from Europe with NHS partners, universities and industry, and we share good practice and look at what could get us ahead of the game and what we need to develop and work with. So there's lots of examples across HSNs of network to catalyse thinking and to bring people together who can impact for service users. So I talked very briefly about the NHS National Innovation Accelerator. And this is a programme that's run and sponsored by Academic Health Science Networks in NHS England. We put the money into it. And every year we select a number of innovators who we think have got great products that will be easy to market. And they might have some issues. They might not have a robust business plan because they don't understand the NHS sector. They may need some help with marketing or putting in touch with the right people. And what we do through this product is we assess the actual innovator themselves. So they're going to be a fellow on the programme. Have they got resilience? Have they got patience? Because this takes quite a long time. Is the business plan stacking up? Even though it might not be the finished version, is it something that we think could help the residents and support the NHS? So these are three of the Innovation Fellows who were selected last year. I'm going to talk a little bit about Kardia. We've got Matt Jameson, who people may know from Health Unlocked, and Health Unlocked is a social network. There are 500 networks on there, so if you're somebody that's wanting to diet or you're wanting to up your exercise, you can go on and look at how other people are doing that. If you've got a serious condition such as Parkinson's, there's a network for you. So it's basically putting in touch with each other, and the peer support that Ros was talking about, asking questions of people who have lived that condition, you can do all that on that site. Lloyd Humphreys, people know from Patient Knows Best, and this is an integrated patient portal. It's part of the secure NHS N3 network, and it pulls together the NHS records, social care records, a carer can go on there. So there's a single record that's controlled by the resident or the patient. So they control that record, they say who they want to see it, and it sits with them. So these are the sort of products we've been championing. We had 17 last year, we've got another 8 this year, and I know there's people at the conference who applied for this year's competition. I don't know which 8 have got through. It launches on the 9th of November, but it's a really good way to get your product out there and to get some support. So this is one example that I think is particularly good about how to get a tech product into a health market. So this is Kardia from AliveCore, and it's a tiny little ECG device. So it's about 1.5 inches long, fits on the back of a smartphone. You download an app and you can take an instant ECG by putting your thumbs on the device. It costs £75 on Amazon, so it's cheap to use. We've been priming it into GP surgeries. They love it. They've been buying lots of them because it saves a lot of work. So if you come into a surgery, you're somebody that might be of an age where the GP thinks this person might have an irregular heartbeat, so an atrial fibrillation. You can be tested there and then. It's very quick. You get a record you can email to the hospital, to your GP, to your carer. And it tells the GP if you've got an atrial fibrillation. And if you have got an atrial fibrillation, that can cause you to have a devastating stroke. So strokes due to AF mean that you'll be out of work probably, you'll probably be disabled, you'll have to have a carer. So absolutely devastating for the person and the family. And obviously for the NHS system, that's very costly. You've got people being in the service who don't need to be in the service. But you can't put a product into a health pathway like this without some support. So what goes hand in hand with that is guidance for GPs. So if you pick up somebody who's got an AF, what do you then do? What treatment do you give them? What support do you give them to prevent them having a stroke? So this product had to fit within a pathway, but is being very successful. And the successful thing about this as well is a patient pull. People who have got AF or have had AF and want to control it buy these themselves. They're very cheap. So in terms of keeping the health system sustainable, it contributes to that agenda, and it contributes to keeping people out of hospital and helping them to monitor their own conditions. So through the Accelerator, we've got 345 NHS providers and commissioners using the product, so it's been really effective in getting people to think about how they might fit these products into NHS pathways. And we've raised about £17 million for the businesses because they've been able to get contracts to get the businesses into practice. So it's a really practical way of getting things out there that support residents but also support businesses and jobs. Now, the other national programme that we work on is one called the Clinical Entrepreneurs Programme. And this is a cohort of 100 really innovative clinicians. And sometimes they've got ideas that they've come up with themselves, so innovative products. And we want to keep those products in the NHS. And we actually want to keep these people in the NHS. A lot of our clinicians who are junior doctors come into the service, they've got great ideas, they might have a product, and that's quickly squashed out of them and they're taught to get on with the day job. Well, we want to keep these people in the NHS, and there's 2 reasons. One is that we want innovative people so that when tech products and service improvements come along, we've got people who are open to bringing them into the NHS. But we also want some of the products as well, and we want them to market them and grow them within the UK so that we can give the best treatment to residents. So in the north, we have quite a few of these brilliant clinical entrepreneurs, and we actually have a base for them in Alderhay Hospital. So Alderhay is a fully digital hospital, brand new, and underneath there we've got what we call the Bat Cave, and it's an innovation space for the entrepreneurs and other innovators to come along. So this is one of the brilliant clinical entrepreneurs, Jing Oh-Young. Jing's first product when I saw him was a toolkit for supporting children to eat healthily, and then very quickly he started developing other products. So this is his Ergo wheelchair. This is an app that a wheelchair user has, and it helps them to adjust their position in the wheelchair. So it's very practical, easy to use, and just helps that person to have a better quality of life. So loads of fantastic ideas coming out from these entrepreneurs, but one of the reasons for us to do this as well is to keep innovation within the NHS system, so we get products in there. So some of the other national initiatives that you've already heard about this morning, we support the Vanguards, which are 50 areas looking at how to do care systems differently and bring populations together around a different model of healthcare. And one of the things that we've found has been really important has been some system modelling. So to use some of our technologies to model how systems might look differently, so that we can look at where innovation can apply. We've already talked about the role of housing. NHS England has a programme called Healthy New Towns. 10 areas across England have been awarded this status, and this is about building, not always building or converting new homes that are fully digitally enabled. So we support people in managing health conditions, living at home successfully without having to go into hospital. We've got the Global Digital Exemplar Hospitals, 10 of these across England, and they're the hospitals that are digitally mature, that are using technology to benefit residents, and academic health science networks are supporting them with adoption and spread of some of their technologies. Beverly's already talked about test beds, and I'm going to talk a little bit now about the 100,000 Genomes Project. So the 100,000 Genomes Project is a massive research project sponsored by NHS England. And this is about testing 100,000 genomes of residents in the UK so that we can personalise treatment. And this actually started with David Cameron. So you remember very sadly that David Cameron's son Ivan died, and he was actually diagnosed after he died with a very rare condition. So David Cameron quite rightly said, you know, each child is precious and irreplaceable. I don't want this to happen to another parent. So a very personal start to a campaign that's having really excellent results. So the aim of the project is to look at somebody's individual gene, map those variants to genes to look at what different conditions we could have, and use new treatment devices and diagnostics to help us treat some of those conditions. And it's also about increasing public understanding. This actually is healthcare of the future. It's innovation in practice that we can all have personalised healthcare. And we also want the UK to be seen as a market leader in life sciences, that we're doing something really innovative that gets us ahead of the game. And companies want to come and invest here and see us as a place where we can also export healthcare products. So this is an example of how it's working in practice. So these lovely 5 newborn babies on the slide were all diagnosed with diabetes in the womb. Now, we all know that as a treatment for diabetes is insulin, and if those babies had been born before the 100,000 genomes had been weighed, and insulin would have been given according to the weight of the baby. And very sadly, 4 out of those 5 babies would have died because the treatment wouldn't have been just right for them. With the genome sequencing, they can be tested as soon as they're born and given appropriate treatment. And 5 of those babies will survive. So all of them will survive because we can look at what their variant of diabetes is and they will survive. So really sort of powerful results. And that's using drugs to treat people. The spin-off from this project has been to look at actually sometimes we don't need a drug. So this is Jessica, she's 4-year-old, she was suffering seizures and the health service couldn't diagnose what was wrong with Jessica. When her genome was sequenced, it was found out that she had a deficiency syndrome in her gut that could actually be treated by a low carbohydrate diet. So Jessica's symptoms were actually treated by something really cheap, something she could control herself. So there's lots of spin-offs coming out of this project, and we're on target to deliver the 100,000 genomes being sequenced across the country. And there's lots of opportunities in this area actually for diagnostic technologies that can support this project going forward, because it's something at the moment, it is a massive research project that we need to mainstream it into health services. So I've talked a little bit about networking. HSNs are all about brokering relationships, collaborations and interoperability. And this slide is about one of the interoperability programs. Talked about we have different sources of funding. Across the north, there are 4 HSENs, and we've been funded from Northern Powerhouse monies to look at matching our data that we hold in healthcare systems to planning frontline services. So the Connected Health Cities programme pulls together universities, the NHS and business. And in our particular region, we're focusing on COPD, alcohol and epilepsy as pathways where we think we've got lots of data. We work with citizens, we've got a citizens' senate to look at appropriate consent for this data, and we can use it to plan future services that serve residents. Most HSNs also have innovation exchanges, so if you've got a product that you think, actually, I think this product could make a difference to lives and it will be efficient and sustainable, we can support you in developing that product. So if you come to us with an early stage product, we can signpost you and give you support about how to develop it. If you've got a product that's up and running, we'll advertise it on our portals and help you to get support. This is our own particular innovation exchange, but I'm going to give you the details of all HSNs so you can look for your local one if you want to go to your local HSN for support. So we've also been working nationally on the innovation tariff. So this was announced by Simon Stevens earlier in the year. And we've been thinking about what products might fit within that tariff. Really good news that NHS England are thinking very broadly about innovation, and they've been so supportive of national and regional organisations who are trying to put innovation into practice. So we've sat down and had a look at this. We need evidence-based innovations and products. We're actually looking to achieve an outcome. So within the tariff, we're not going to say it's going to be this particular product. We're going to say the outcome that we want to achieve will be X. So it might be more people being able to self-manage a condition and what products fit with that. But we're aware that within the health system, sometimes it's very difficult for people to just take a step out and temporarily fund a product because you haven't got the monies. And that system of reimbursement really isn't helping people like yourselves who might have a technical product or a business that they need to sustain. And we're also considering these products. I think simple is best. So if you've got a product, it's easy to use. There obviously will be some training and guidance for people who need to use it. How can that be simplified so things are very easy and get into pathways easily? So the tariff should be announced at the end of this month with some products and outcomes that we're wanting to see as part of that. So part of our role, obviously, I'm here at TSA because we want to create partnerships with industry and national bodies. We also work with other people such as ABHI, ABPI, and with our local enterprise partnerships who can support technical products and businesses to get traction. We have our own innovation pathway that we've adopted across academic health science networks. And this is to help companies to navigate what can be quite a complicated landscape across healthcare, housing and associated sectors. So if your company is at any of these stages, you can contact your local HSN and we will either support you directly with business support that we're funded for, or we'll signpost you in the right direction. The SBRI, Small Business Research Initiative competitions, this runs for ideas that are at early stage but have got great potential to make a difference. So you might be in the middle of clinical trials, or you might have something that you've got evidence that will work but is not quite there yet. We work alongside that programme. And there's actually a competition running at the moment. So if you go on the SBRI website, there's a competition running about GPs of the future. So if you've got a technical product that you think actually that would fit with that remit, you can apply for some SBRI funding. So I should have a final slide. I think it's disappeared. So, so this is just a little summary of what our partners are saying. So obviously these are the positive partners that have come back to us and said, we think you're doing great work. And I think what they're saying is that they've got introductions, sometimes they've got part funding, they've got products to market, they've been able to grow the business. So they've found working with academic health science networks really useful. And I hope that's been your experience. And if anybody is here that's thinking, well, I didn't have such a good experience, please do come and chat to me about that, because we do work across the network to support colleagues. So these are all our contact details. There'll be the Chief Officer on there of your local HSN, or please do feel free to talk to me later on. Thank you.